Hello everybody, and thank you so much for having me. My name is Denise and I'm running for State Representative for the 76th District here in Clinton and Union Counties. A little bit about me. I'm a mom of 4 with 2 boys still at home. I was a paralegal for 15 years before moving to Clinton County. I attended Lock Haven University where I earned my bachelor's degree in business management. And since education is important to me, I continued on and earned my master's degree in healthcare management. This provided me the opportunity to become the Human Resources Director at our local nursing home here in Clinton County, which is Suskiview Home. Now, while I was attending school, I worked as a bus driver for Keystone Central School District because it fit well within my school schedule. It presented a lot of challenges, but I was able to get through it because of my life experiences as a working mother. And I'm pretty sure there's some of you out there that can relate to me. During my schooling, I was privileged to become a member of AmeriCorps. Service has always been important to me, so I decided to run for state representative when I saw that the needs of the district and its constituents were not being met. This seemed like an opportunity to offer my skills and experience and to increase my service to the community. Now, I've been asked to answer a couple of questions for you, and I'll go ahead and do that now. Question 1, what have you done to familiarize yourself with the issues and the parts of the district that are new to you? What do you see as the differences, similarities, between the needs of the constituents in Clinton and Union counties? My answer to this would be, to help familiarize myself with the new parts of the district, I spent a lot of time visiting voters in Mifflinburg, Lewisburg, Hartley, and other municipalities. I have also attended borough and township meetings in Union and Clinton counties. I found this very helpful in finding out what concerns the voters. Now, the top concerns in both counties are focused on the aging infrastructure of the roads and bridges and access to reliable broadband and cell service. Traveling around the most rural parts of the counties can be difficult to navigate due to poor cell phone quality. Now, we all can relate to losing that cell service when we're trying to find an area. They're also concerned about equitable funding for the school districts and that our children are provided with all the advantages they require to meet the needs of their future. Of course, affordable, quality healthcare is also of concern. I'm highly qualified in this area and believe that I can help facilitate improvements to the current systems. Now, there are many similarities between the two counties. The first thing that stands out is the rural nature in the small neighborhoods. The people are friendly and concerned about what's happening near them. Both areas have universities which provide some diversity of interest and culture. Of the differences that I notice is that Lewisburg Borough has a more abundant tax base than almost anywhere else in our district. I know that the counties are working to adjust this, and I plan to be a part of the discussion and the ultimate solution. Now, the second question is, why should voters elect you and not your primary opponent or your incumbent? My answer to you would be this. My 15 years of experience as a paralegal gives me the tools necessary to understand complex legal documents, including bills which will be presented to me for consideration. Applying my understanding of the legal framework required in writing bills makes me the most qualified candidate. From speaking to voters in Clinton County, there has been a lack of constituent services for people who did not vote for the incumbent. When voters try to call and discuss any concerns, the incumbent is unavailable or flat out will not take an appointment with them. That is completely unacceptable for any representative. I will always meet and talk with anyone who has concerns or problems. If you have a problem, then we have a problem. With my education and my current position as Human Resources Director in a long-term care facility, I have helped many employees dig in and understand difficult medical bills and coverage concerns. I know firsthand what it's like to have a decision. I know what it's like to make a decision about health care and whether I can afford the deductible for the treatment. These are the concerns that keep voters up at night, and I can help them find answers and solutions for them. I bring the passion and the commitment to service that role a state representative requires. The next question is, the COVID-19 pandemic has demonstrated weakness in healthcare in rural Pennsylvania in particular. What would you do to improve healthcare, including mental health care and delivery in rural Pennsylvania? Living in a rural district presents unique difficulties when trying to navigate the healthcare system. Oftentimes, people are required to travel a minimum of 30 and sometimes 60 minutes just to get the level of care that they need. This can also cause hardship for families who want to stay near their loved ones. With increased use of telemedicine, patients should be able to receive care closer to home. There should be appropriately trained staff to deal with special needs patients. The cost to adequately train staff would be possible in rural areas with an increase in Medicare and Medicaid payments to providers in healthcare facilities. Currently, these payments barely cover the basic cost of supplies, let alone the cost of provider staff and basic overhead. There was a mental health crisis in rural areas prior to COVID-19, and it only got worse during the pandemic. Not only was it difficult to get the care people needed, but there was also increased stressors. It was nearly impossible for people to get the services that they needed during the incredible stressful time. This even included addiction treatments. People struggled without access to their support meetings that are necessary for them to maintain sobriety. One way to address these issues is to provide mentorships with healthcare providers and staff, thereby increasing the number of professionals in these fields. Establishing a working relationship with school districts to increase the number of students who might choose this profession would help to ensure a steady stream of upcoming healthcare givers in these fields. The next question is, how would you address broadband availability for rural areas? Public utilities like water, electric, and heating are required to maintain a certain level of infrastructure to reach all areas. Broadband access and self-service should become part of this integral infrastructure. Children and families should not have to go to their local McDonald's or the public library to get access to internet for work or school. And of course, during the pandemic, those libraries were closed. Rural areas have been suffering with a lack of accessibility for far too long. The pandemic proved that this must be addressed immediately as we move into a widespread digital age. Moreover, having greater access to broadband allows children and adults the ability to take online courses that are necessary to excel and compete in a global marketplace. Now, the next question is, each of the Pennsylvania's 6 neighboring states already have a minimum wage higher than $7.25 an hour. Do you support raising the minimum wage for all workers in Pennsylvania? In order to be competitive with our neighboring states, I support increasing the minimum wage. I would even consider renaming it the living wage. Many studies show that when individuals are provided the opportunity for increased income, they infuse that money back into the economy. In addition, the increase should be spread out over a few years to help cushion the employer's ability to pay these increases. I know that many people are concerned about the rising costs being put back onto the consumer. But the reality is those costs rise even without wage increases. Clearly, our bordering states did not suffer from the increase in wages. They continue to maintain and even grow their economies and create jobs with these changes. Pennsylvania has so much to offer, and we should not limit ourselves and place undue burdens on the back of our workers. The final question is, how would you address fair funding for public school districts? One of the first things that needs to happen with school funding is that the per-student amount of allocated dollars needs to be standardized. Currently, the hold harmless practice continues to provide school districts with the same funding regardless of enrollment. This means that schools with growing enrollment often rely on increasing taxes to account for the shortfall. The areas that are disproportionately impacted are often rural districts that have a lower tax revenue available. This is not a quick fix, but it's the job of the legislator to restructure the way funding is allocated, and this would be the first step to take to begin to correct this problem. When schools with lower registration receive just as much or more per student than other schools with increasing enrollment, this is clearly a broken system and must be repaired.